A typical Achilles tendonitis is going to get better. It's going to get better with rest, ice, heel lift, potentially injections, immobilization. These are the modalities that we utilize for the traditional, typical Achilles tendonitis. However, if your Achilles tendon is still not getting better, you've got another part to the equation that just is not being addressed. And if this other part of the equation isn't being addressed, it's going to continue. It's going to become chronic. It's going to be an issue for a long period of time. And these are the conditions that I would like to speak to today. Not your traditional, easy, run-of-the-mill Achilles tendonitis, but the ones that are complicated, the ones that just won't get better. My name is Dr. Richard Loninger. I'm a foot and ankle surgeon in Manhattan, New York for the last 30 years. This is an educational video entirely. It is not designed to take the place of a doctor-patient relationship. With that being said, let's get to it. So, an Achilles tendon is a weakening. It's a chronic inflammatory condition of the Achilles tendon. So when inflammation first appears due to maybe an overuse or microtraumatic ripping and tearing, chronic inflammation becomes degradative. Once it becomes degradative, it's going to weaken that Achilles tendon. And that weakness of the Achilles tendon is that chronic repetitive weakness, and then restitution. It continues. Weakness, then restitution. And it goes on for a long, long period of time. It could be months. It could be years even. Okay? It can either be at the mid-substance of the Achilles tendon, or it could be at the insertion of the Achilles tendon in the calcaneus. This condition, this chronic condition, is always accompanied by a nerve problem that's associated with it. The nerve, when it is aggravated, when it is the posterior tibial nerve that's aggravated, or the sciatic nerve, or the spinal cord that's inflamed and aggravated, it causes the nerve rootlets to the extremity to be aggravated and inflamed. And when they're inflamed, that nerve, again, as I've spoken about in my other videos and other musculoskeletal chronic ailments, when that nerve becomes inflamed, it is in charge of the amount of circulation that extremity gets. And what happens is that nerve controls the tonicity of arteries and veins in the localized area. And as a result of it losing that ability to maintain tonicity, there's a relative increase in circulation. As a result of that increase in circulation, that will act as a fire hose. That fire hose washes away those ions that allow for structural stability of the Achilles tendon, and that's what causes the weakness, the chronic weakness of the Achilles tendon. So we must treat the Achilles tendon, and we must treat the localized nerve problem. Localized nerve problem is never just localized. There's no such thing as one nerve that's aggravated. It's communicating, the nerve to the lower extremity is communicating to the spinal cord. And usually what happens is we've got a spinal cord issue or a nerve rootlet issue. We've got a vertebral issue. We have a spine issue that's causing this excitation of the nerve. The nerve then again controls that circulation to the extremity. So in order to resolve this problem, you need to go after the nerve of the lower extremity, and you need to go after the nerve at the spinal cord. What we do in my practice in 30 years is we address the Achilles tendon with shockwave and PRP. PRP is us taking blood from you, spinning it in a centrifuge, separating it, and administering the healing cells into the sheath of the Achilles tendon. We also do a shockwave. A shockwave is going to bombard that Achilles tendon with an acoustic impulse, and that allows for the recovery. It institutes an augmented immune response, and it allows for a recovery. However, that will be short-lived if we don't address the nerve problem. So the nerve problem needs to be addressed by giving you directed nerve blocks to the main nerve trunk at the lower extremity, but also all the adjacent nerves as well around that foot and ankle. They all need to be calmed down. In addition, we go after the back. We go after the back with these exercises that we have that are instituted to restore proper curvatures to the spine and diminish impingements that are occurring either at the spinal cord level or at the nerve rootlet level. That's something that's only performed with a little bit of anesthesia in the arm, IV sedation. It relaxes you. It allows for me to perform this procedure in a painless manner. Now, after we're done, you're able to walk, you're able to function, you're able to go out to dinner that next night. And once we see that the Achilles tendon is perfect, there is no more inflammation, we allow you to start running and jumping again. That's usually a couple of days after the procedure. So this is what's missing, is the whole second half of the equation if you have chronic Achilles tendon problems. Now, if you're in the New York, New Jersey area, you could come in and see me if you'd like. You can make an appointment. You could hit that link to my website. Give us a call. You can make an appointment for a telemed appointment, or if you're not in the New York, New Jersey area, you can hit that link to Gumroad and you can receive my 5-point protocol on how we take care of this problem for a $50 fee. The 5-point protocol is established utilizing my personal framework that I've utilized, that I just explained, that I've been utilizing for the last 30 years. First point is we're going to educate you on the proper exercises for your back to restore proper curvatures and to diminish the impingements that are occurring at the spine. Secondly, we're going to give you a link to Amazon where we could purchase a device that goes inside your shoes that's going to diminish the workload of that Achilles tendon. Thirdly, we're going to give you a link again to Amazon where you can get some nutritional supplementation that will help allow for the recovery of that neurological process. We're also going to recommend a physical therapy modality of the foot and ankle that's going to diminish the inflammation of both the Achilles tendon and the neurological process. The fifth point, we're going to give you a recommendation to a doctor where we're going to recommend certain anti-inflammatories that work, that are not going to be your common NSAIDs, your ibuprofen, Motrin, Advil, Naprosyn, Aleve, things of that nature that don't work on the neurological system. So you're welcome to hit that link and get that pertinent information so that you can navigate this problem on your own at home. Thank you.